discussing that. First thing is what is sound. So a series of compression and expansions through a medium. Very important thing that a medium is important for a sound to travel. For instance, if we vacuum out the air from the room, so we will be discussing before we die, we will not be able to convey our cries, to convey our sound to others who are outside the room. Why? Because there is no medium for our sound to travel. And if the medium, which is air around us, is not there, in its absence, we will not be able to get oxygen, which can result in death. So a medium for traveling of sound waves is important. Sound is a mechanical wave, and it results with the compression and expansion. Here we can see these are the sound waves, how they compress and creates pressure, then expands. So once our tongue is touching the teeth, palate, different structures in the mouth, and we use energy to produce sound, with the movement of these structures, some sound is produced which travels outside the mouth, and if there is medium, it travels mechanically, and when it strikes the eardrum with different velocities and frequencies, with the experience of understanding that words, the person who is a recipient of the sound waves is hearing, can understand what we are talking about. Obviously, the knowledge of that language or about that words, about that sound is important. The sound can be of different types. It can be audible, or it can be above the frequencies which are audible. It can be below that range. We will discuss in next slides. The second important thing is velocity. Velocity is the speed of sound with which it travels in a medium. In air, we need 330 meters per second for traveling. In water, 1480 meters per second. In fats, 1450. In liver, we need 1545. In kidneys, 1561. And in muscles, 1585. So for a human body, we have taken an average velocity in soft tissues for human body as 1540 meters per second, at which we adjust our machines, ultrasound machines. So the frequency can be audible or not audible. The not audible can be of two types: infra sound waves and ultrasound waves. The audible sound waves, the frequency of that sound waves which are audible to the human ear ranges from 20 hertz to 20 kilohertz, which is 20,000 kilohertz. If the ears of an individual are normal. Above that is ultrasound. But keep in mind, the dogs can hear, this is for human being, 20,000 hertz. For dogs, the normal range is 50,000 hertz. For bats, it is 100,000. 100K, which is kilohertz. Now for medical diagnostic ultrasound, we use 1 megahertz to 20 megahertz. Before we go in details, we need to know we have discussed the sound. We need to know the definition of ultrasound also. According to Mercury's dictionary, ultrasound is defined as pressure waves whose frequencies are above the audible limit. So the pressure waves, which are not audible to the human ear, so the sound waves, they are transmitted into the body, they strike various organs, they come back, reflect, scatter, and return echoes are collected. Echoes are the sound waves which strike and come back. So the returning sound waves are called echoes. If you look at the history of ultrasound, in 1910, in the beginning of 19th century, the theory about ultrasound sonar was developed in France. Sonar is an instrument which is used in submarines to detect the depth of the ocean, using sound waves, detecting the time which was required for going and coming back. So the total duration was divided with 2, and the distance was measured knowing the speed of sound. So if you know the speed of sound and you know the time taken, you can calculate the distance from the submarine to the depth of the ocean, or from one structure to the other structure. In 1942, A mode, which is activity mode, was invented in Austria for brain scanning. Whereas in 1950s, M mode was invented, which is motion mode. And in USA, B mode was invented for clinical application in same year. The CW, which is the continuous wave mode, was invented in Japan for heart valve applications. Pulse wave Doppler mode was invented in 1959. And color Doppler mode was invented in Japan in 1983. Kurtz, an Austrian company, made the first commercial 3D ultrasound scanner in 1990. Here is the sonar. This is how you can detect the depth. Here is a ship. You can get down the source, then you can emit sound waves. And here is the receive array. So the sound waves, they strike the target, come back, and can be received here. So a ship can detect the depth of any organ or depth of submarine in the ocean. This was the beginning. Then comes the activity or amplitude mode, which was the strength of the signal on graph. Here you can see the strength of the signals. How is the amplitude? And this is an ancient picture showing a lesion here and sound waves traveling, and we are getting the amplitude. It was in 1942. Then is motion mode displayed over time. We can see the function of M mode is to display tissue motion and usually used in echocardiography. This is depth versus time. Brightness mode is displayed as dots on screen. Stronger signals will give us brighter dots. So the things which will reflect more, which will reflect sound waves more, will appear hyperechoic, white, brighter. So B mode is also called 2D mode, two-dimensional mode, and its function is to display tissue structures. This was in 1950s. Here is the convex probe, the transducer, which is convex. It looks like this, and it is curved or curvilinear. It will give us this type of image. Here you can see the probe will be here, and it is a convex image in which we can see the liver and diaphragm and some of the hepatic vessels. This is a linear transducer. We can see the rectangular image formed by it, and we can use color Doppler along with it. These are the carotids and the vertebrae giving shadow. So linear transducer gives us a rectangular image. It is used on straight organs. We can use it for scrotal penile ultrasound, for thyroid, for breast, for musculoskeletal. The pulse rate Doppler, which is used for cardiac imaging, and just rectangular image, it is used on straight organs. It is like a phase array for scrotal penile ultrasound in moving organs, and especially in heart. Christian Andres Doppler found Doppler principle in 1842, and according to his principle, he described that once a train engine is moving and its horn is on, creating sound, when it is moving towards us, if we are standing on a platform and a train is coming with the horn which is on, once it is approaching us, the sound will increase. When it passes through us, coming, and it goes away from us, the sound will decrease. But when the source of sound is at 90 degrees to our ears, there will be fraction of seconds for which there will be no sound because it is changing from positive to negative. That is called Doppler angle. So it depends the structure with which it is striking is static or moving. When we use Doppler, we get colors whenever there is movement of RBCs, there is blood. So if the blood is clotted, we will not get the colors. Here are the sound waves which are traveling towards the blood cells. The blood cells are moving, they are striking with the sound waves, they are increasing its energy. That rebound sound waves are going back to the transducer, which is showing us colors. Even water or even the urine in the fetal life, when the fetus is passing urine, if it is moving, it will give you colors. It doesn't matter it is blood or any other fluid, anything moving will give us color. When it is moving towards a transducer, it gives us red color, and when it is moving away from the transducer, it will give us blue color. Even nowadays, we can change the colors. We can assign any color to the sound waves which are traveling towards the transducer and vice versa. This was a formula for calculation. FD is equal to 2FV cos theta divided by C. FD is the Doppler shift of the frequency. F is transmitted frequency, V is velocity of the blood, theta is angle of incidence between the ultrasound beam and the direction of the flow, C is speed of sound in tissues. Then comes a transducer. The transducers are of different types. As we saw, they can be linear convex, phase array, or transvaginal or transrectal, which are the endocavity transducers. These are the piezoelectric crystals. The piezo or piezoelectricity is an effect which is very important to be described. There are several types of transducers available. The construction varies according to application, like mechanical, sector, phased array. We can have annular, linear, curved, and specialized, the intercavity, which are the operative ones. Crystals are the piezoelectric crystals are the materials which produce a voltage when deformed by an applied pressure and produce a pressure when deformed by an applied voltage. So when we give them voltage, they produce pressure, and sound waves are pressure waves. So sound is produced. And when the echoes come back in the form of sound, they strike these crystals, then these crystals produce voltage, which are the messages in the form of voltage, which are received by the receiver in our machine. So we give voltage, we put on the machine, we give voltage to the transducer. Transducer has got a place, a house for these crystals, which are placed in it in a specific manner. They are stimulated, and they are stimulated by the voltage, and then they move, and by compression and movement, they produce pressure. That pressure goes out of the face of the transducer towards the body, which is the focus part of the body which we want to visualize. It goes, it strikes, and then after striking, it will be coming back as a rebound sound and is recaptured, is received by the receiver. We have amplifier which will amplify these sound waves according to the requirement. There are multiple processes which are going on. We will discuss in this lecture. So the basic theme is, due to voltage stimulus, the sound waves are produced from the crystals. The crystals are the structures which are piezoelectric, and they produce sound waves. Sound waves, they travel, strike different organs of the body, they come back, they are recaptured by the transducer. When these sound waves, pressure waves, they come back, they again strike these piezoelectric crystals, and that messages are taken by the receiver of the machine and shown as images in the form of white and black dots, which is on B mode. These crystals are nowadays artificially grown and treated with high temperature and strong electric field to produce piezoelectric properties necessary to generate sound waves. This is how it works, depending on polarity of voltage applied. So the crystals, they expand or they contract. This is, they are placed in this form and they move in a sequence in a specific way. So they are not practically striking with each other to produce sound. They are placed at a distance which is of micro level, and due to change of the polarity, they move. The basic transducer has got different structures. It sends pulses and receives echoes. We can see this is the case. Here is the house which has got piezoelectric crystals, and this part of transducer is in touch with the body of the patient, having a gel in between. Critical component of the system, there will be profound effect on image quality. Here we have the electrical connection. There will be damping material here. So piezoelectric crystals, and this is the phase. This is how the sound waves they travel. So there will be, it will be pressure wave. So there will be compression and expansion. So if there is no damping material, the wavelength will be larger. So in order to keep it in controls, we put damping material. We can have multi-element transducers, which are common nowadays. They use multiple crystal elements in the formation of each pulse. So waveform from each element combine to form a single wave front. This is Huygens principle. So each individual element is electrically and acoustically isolated, allowing flexibility in beam formation. So they form small beams which unite and which form one beam. Then there is a question about real-time transducer. All these transducers are real-time because they form a real-time picture. So transducers produced by different manufacturers may have similar frequency, size and shape of footprint, but have quite different beam characteristics due to differences in construction and proprietary software drivers. So they can have widely varying number of elements, thus aperture widths. So we need to know our transducers and their capabilities. Here is the cable. This is transducer. The damping material is here. The crystals are placed housing here. So it will have a near field and a far field. And in between the near field and far field of the beam which is produced, there is transition point. So just imagine the beam of light which is produced by your torch. So it is a beam of sound waves which has got three components. The main two components are near field and far field. So it will expand at the transitional point. After focusing, we apply aperture on the transitional point. So we decrease its size in order to decrease the far field. This is curved crystal, the lens, and electronic array. This is how the beams are produced. Keep in mind the beams are three-dimensional. So image requires a very narrow beam and focusing allows improvement. This is how there are side beams and focusing allows. So we have to concentrate on the center beam. This is our focus. This is how, in addition to it, there are multiple side beams which are produced. Here you can see, which can create some artifacts. Side lobes are still around, so there are manufacturers, they are trying to get rid of it. And we know that they cause artifacts. The artifacts are the unwanted effects, which we don't need, but still they are there. The piezoelectric effect, if expansion and contraction occurs more than 20,000 times per second, ultrasound is produced. So until applied voltage is stopped, that is called continuous wave. So if expansion and contraction is 20,000 per second, then sound is produced, and if it keeps on moving, unless the voltage is stopped, it goes continuous. Whereas the voltage applied for very short time, crystal resonates or rings, ringing decays, and a pulse is produced. So it comes in pulses. Larger voltage, louder ring. That is pulse wave. It is not a continuous wave. Pulse echo imaging. Here is our transducer, and this is a cut section of the body, transducer. These are the emitted sound waves and image formed by sending out a short pulse of sound along a narrow beam path. The sound waves, they strike and they come back, which is called echo. Another important thing in ultrasound physics is resolution. The general definition of resolution is the ability to distinguish echoes in terms of time, space, or strength. Thus, good resolution is critical to the production of high quality images. So the ability of an ultrasound system to demonstrate differentiation between tissues having different characteristics, for example, adult liver, spleen, lung, and liver. Here you can see the pancreas, vessels, a part of liver, and this is how we can differentiate between them because of their echo texture. And it depends on contrast resolution. Here you can see the body of a fetus, urinary bladder, heart, ribs, and we can see the intestines. So we can differentiate between the lungs and liver of the fetus. Then is temporal resolution, the ability of an ultrasound system to accurately show changes in the underlying anatomy over time. So good temporal resolution is particularly important in echocardiography. Why? Because the structures are moving. So the definition for spatial resolution is that the ability of an ultrasound system to detect and display structures that are close together. Now the structures close together can be lying near to each other, or right and left to each other, or superior and inferior to each other. So the spatial resolution is to distinguish, to differentiate between two structures which are lying close to each other. So ultrasound images show depth into the patient and width across the section of the anatomy. There are two types of spatial resolution. First is axial and other is lateral type of spatial resolution. Keep in mind, spatial resolution is the ability of your ultrasound machine to differentiate between two structures which are lying close to each other. So now the ability to differentiate separate structures along the beam, which are along the beam, is axial, and if they are right to left, which is structures across the beam, is the lateral type of spatial resolution. Here you can see the spatial axial type of spatial resolution, two structures lying, one is lying above the other. So we can differentiate, we can see these are two vessels. We can have aorta and IVC, or we can have two other structures which are lying very close. If they appear like one dot, it means the axial type of spatial resolution in that machine is not working properly. So it is one pulse in axial resolution. If the wavelength is longer, there will be poor resolution. So we can adjust the wavelength to have a good resolution. The number of cycles in pulse and length of each cycle or wavelength of beam is important. The spatial resolution depends on it. In lateral resolution, the ability of an ultrasound system to distinguish between two separate targets perpendicular to the beam path, same distance from the transducer, lying next to each other. As we can see, usually once we are scanning the patient lying supine, we can see aorta and IVC, which have same distance from the transducer. When we can differentiate between them, this is normal. But if they appear like one structure, we cannot differentiate between them, then the resolution, which is the lateral type of spatial resolution, is not working properly. For lateral resolution, it depends upon beam width. So we can adjust the beam width. We try to bring the structure in the center of the beam. Then we will get the best lateral resolution. If we try to bring it here, both structures, they will combine and they will appear as one structure. So best, the art is to have the structure in the center. How we adjust it by decreasing the width of the beam through the knobs. If we get the structure here or here, where the width of the beam is more, we will have structures appearing like this, united, mixed up. And if it is like this, we can see the structures distinguished from each other. Lateral resolution beam width depends on transducer design, frequency, and focusing. These are important. Then comes attenuation. Attenuation means the loss of energy. As sound traverses body tissues, various factors causes it to lose energy, thus to undergo a reduction in amplitude intensity. Loss of energy is attenuation, and attenuation can be of four types. So when the sound waves travels into the body of a human being, or body of the patient, it will have loss of energy, which can be due to scattering, reflection, refraction, and absorption. So four processes which are equal. If we go for the quantity, that will be 25% loss is by scattering, 25% by absorption, 25% by refraction, 25% by reflection. So they take equal part. So the total energy loss is equal to the sum of energy loss by these four processes during the sound wave is traveling towards that tissue which we are focusing, and the sound waves which are coming back in the form of echoes. So while traveling from the transducer to the organs to the body and coming back to the transducer in the form of echo, in going and coming back, there will be four type of um, processes which are taking place, which causes loss of energy, which is attenuation. The amount of energy loss is determined by tissue involved, distance traveled, and frequency of beam. Dependence on frequency is important, limits the penetration of an ultrasound beam of given frequency. So four main processes contribute to attenuation: reflection, refraction, absorption, and scattering. All factors affect transmitted beam and returning echoes equally. So amount of attenuation depends on total path length of beam. Approximate rate of attenuation in soft tissue is 1 dB per megahertz. So if I am using 3.5 megahertz transducer for scanning of viscera, for instance, liver, the loss of energy will be about 3.5 dB. These 3.5 decibels will be compensated by our bank. The bank is our machine, and machine will give that energy to the sound waves to make them that much powerful so that they can hand over the message they have brought. Otherwise, they will be so weak that we will not be able to see them. So the knob which is used to give that energy is called gain or time gain compensation, which is the main knob in our machine. We will discuss the knobs in some other lecture about knobology. So reflection occurs between tissues of differing acoustic impedance. Impedance is the resistance. So when there is a resistance mismatch, there will be reflection where the interface is large relative to the wavelength of sound. Some sound is reflected, some is transmitted. Percentage reflection is dependent on magnitude and impedance mismatch, angle of approach, soft tissues versus air, 99% is reflected. Soft tissue versus bone, 40% is reflected. Liver versus kidney, 2% is reflected. Second is specular reflection or diffuse reflection. Specular is in the same angle, whereas diffuse is in different angles. So the deviation of the path of a beam occurring when the beam passes through interfaces between tissues whose speed of sound differs and the angle of incidence is not 90. So this is the angle of incidence. It strikes here. This is the interface. Interface is the boundary between two structures, between two type of tissues. It deviates if the impedance difference is there. So variation in velocity about 10%. So deviation of up to 10% may occur. Refractions can produce in the same angle. Recognize misregistration. Then is absorption. transfer of some beam energy to the tissue through which the sound is traveling. It increases with frequency, produces heat effect, and there will be high frequency. Transducer is not useful at depth. So the high frequency transducer are used to see the structures which are superficial, and low frequency transducers will show us the structures which are more deeper. The fourth process which creates attenuation, which is loss of energy, is scattering. It occurs at interfaces within the beam path. Pattern relies on size of interfaces relative to wavelength. So interface is equal to wavelength, provides much of textural information present in image, and interface and wavelength are very important. We can have relay scattering in RBCs. This is beam attenuation. So when it goes deeper, the sound waves becomes weak and the echoes become more weaker. This is how it appears. If it is closer, there will be less attenuation. The image will be better. If the structure is lying very far or deep, it will appear hypoechoic. It will not be appearing clear. So we use TGC, time gain compensation or gain knob, to make everything clear. So all the energy loss by any of these four processes will be compensated by time gain compensation. So with this knob, we can see all the structures, either they are lying superficial or deep, equally clear. Then comes the Doppler mode in ultrasound. The color Doppler, we can have power Doppler, the directional power Doppler, spectral Doppler, CW and PW, which are the continuous wave Doppler and pulse wave Doppler. In continuous wave Doppler, the speed of blood cell displayed on a time versus velocity graph. Time versus velocity. Its function is to measure velocity to blood flow, especially high velocity flow. We use continuous wave Doppler. This is the sample line, sensitivity region, angle correction, and we get the CW. The principle of CW is some elements are transmitting sound waves, the others are receiving. So there are two parts of elements. Some elements are just continuously emitting, and the other almost 50% are receiving. So continuously it is going on. Whereas in pulse Doppler, there are crystals in one house, they send, then receive, then they send, they receive in based on mean velocity. As I mentioned, we can give any color, we can assign any color nowadays. So it detects the direction of blood flow. Then power Doppler displays volume of blood flow, especially at low velocity, so it is more powerful. It can be directional NGO. It can also give us the color direction nowadays. So direction power Doppler, we can have different maps of colors. So B mode like this, the color mode, and the power Doppler, power mode, it is not directional. When it is power, we can also have power Doppler with directions. This is B mode, which is colored. We have given color to the gray scale, and this is the colored Doppler. Now we come to difference between color and power. Direction, we can detect the direction in color Doppler and directional power Doppler. Color Doppler is angle dependent, whereas power Doppler and directional power Doppler are not angle dependent. Color is dependent on velocity, the other two are not. Colors have normal sensitivity, whereas power and directional power Doppler have high sensitivity. For application, the color Doppler is used for normal velocity, power is for low velocity, and directional power is for low velocity structures, like for small vessels. Power Doppler displays amplitude of signs, how much color Doppler displays velocity, how fast it is. Here you can see the color Doppler, the vertical and oblique. Here is the vessel, we can see the colors. This is for power Doppler because the flow is minimal. So this is angle dependent, the power Doppler is not angle dependent. The difference between power Doppler and the pulse Doppler and continuous wave Doppler is pulse wave, the continuous wave, all elements are transmitted and receiving sound waves. Some elements are transmitting sound waves and others are receiving. The probes, all probes can be used for pulse wave, whereas phased array are used or pencil probes. The velocity is low in pulse wave, whereas it is high in continuous wave. A sample volume is required to locate. This is the sample volume here. We are taking the sample between the two blue lines. And for CW, just a sample line is required, not a sample volume. Then is locate the sample volume, then this is the spectrum, and this is how we get on CW. Windows, yes, we need a window. Here we don't need a window, it is just a line. Applications everywhere, and CW is used for cardiology. The difference between pulse wave Doppler and M mode. This is Doppler, whereas the M mode is pulse echo. Y-axial velocity and frequency shift are present in pulse wave Doppler, whereas in M mode we have depth. Object are hemodynamics and tissue motions. The location is, we can locate the sample volume and sample line in M mode. Like CW, we have a line in M mode. Applications cardiology, vascular, and only cardiology. These are the anatomical M modes. Conventional M mode, how we use it. And this is color M, which is the M mode with color signals. This is how we create panoramic imaging to get whole view. As here we can see the neck with thyroid and trachea. Four-dimensional or three-dimensional. Three-dimension is the whole three dimensions, and when a three-dimensional picture is moving, then we call it four dimensions. These are three-dimensional images. We also have tissue Doppler imaging, which is tissue harmonics or tissue velocity imaging, TVI. I usually use in cardiology. These are tissue Doppler imaging.